TwoPress 2 compression system set is a combination of two non-woven bandages. One of the bandages is made of polypropylene and elastane and is brown in color. The other one is made of polyester and elastin and is white in color. The brown one has a cohesive layer on both sides. The white one has a cohesive layer on one side. The non-active and non-sterile device is available as a kit. The indicator is an application guide for therapeutically effective compression. TwoPress 2 is indicated for the treatment of chronic venous insufficiency with and without venous leg ulcers, thrombophlebitis, varicoses, and chronic edema of other origins. TwoPress 2 may be used on patients with an ankle brachial pressure index, ABPI, of 0.9 to 1.3. Do not use TwoPress 2 in cases of advanced peripheral arterial occlusive disease, decompensated cardiac insufficiency, phlegmasia ceruleus dolens, in case of ABPI of greater than 1.3 or less than or equal to 0.5, or septic phlebitis. TwoPress 2 is indicated for use by medical professionals who have received appropriate training. Before applying TwoPress 2, clean the wound and cover it with a suitable wound dressing. In this example, we are applying Zetuvit Plus superabsorbent dressing as our primary dressing. Next, examine the leg before application to identify bony prominences and potential pressure points, and pad them with a padding bandage. Please use the system as a set and in the correct order. When applying the two bandages, make sure that the patient's foot is at a 90-degree angle to the lower leg. Layer 1 is a short stretch padding bandage which is thin and air permeable. Hold each bandage as shown so the bandage unrolls flat against the foot. Start with the non-cohesive side against the skin, proximal to the base of the toes. After 2 turns for fixation, plantar, from medial to lateral to support pronation, wrap across the back of the foot and enclose the heel using a figure 8. Wrap the foot without stretching the bandage. On the lower leg, wrap the padding bandage around the leg using a spiral technique with 50% overlap, keeping it at full stretch. This may have to be adapted to the patient's anatomical and pathophysiological characteristics. Tear off any excess bandage material beneath the tibial tuberosity and about 2 centimeters below the fibular head. Additional fixation is not necessary. Tape can be used if required. Layer 2 is a long stretch cohesive compression bandage that locks in the first layer and features a visual indicator that supports correct and consistent application. As with the padding bandage, start applying the compression bandage proximal to the base of the toes. After 2 turns for fixation, wrap the bandage around the back of the foot and enclose the heel using a figure 8. Wrap the foot without stretching the bandage and do not yet follow the printed indicator. Wrap the cohesive compression bandage spirally around the leg with an overlap of 50%. To achieve the optimal pressure, stretch the bandage until the indicator printed on it has reached the length of a regular hexagon, with all sides being the same length. The overlap must be 50%. For better orientation, use the center line of the hexagon as a guide. The stretch may have to be adjusted to the patient's anatomical and pathophysiological characteristics. Therapeutically relevant pressure for up to 7 days. The system provides high working pressure and low resting pressure and is suitable for the treatment of various indications, especially chronic insufficiency with and without venous leg ulcers. The visual indicator supports correct and consistent application. Both bandages can be torn by hand and require no additional fixation, and one size covers all leg shapes. TwoPress 2 can be worn with normal shoes. Tear off any excess bandage material beneath the tibial tuberosity and about 2 centimeters below the fibular head. Carefully press the bandage onto the entire leg, as this will ensure optimal cohesion. Additional fixation is not necessary. Tape can be used if required. Check the elongation using the template found on the flap of the packaging. In each TwoPress 2 kit, there is a green hexagon template to guide proper elongation or stretch of layer 2. Simply remove the template from the box and compare it to the indicator on the bandage. When overstretched, the shape is too wide. When the indicator is stretched correctly, you will see the indicator at the edge of the template. When the bandage is only slightly stretched, the shape is very narrow. Press out the perforated hexagon template and use it to check the correct elongation of the second layer. If the indicator is correctly stretched, you will see the printed indicator at the edge of the template. If you have questions about TwoPress 2, please contact your local Hartman representative or call our customer care team at 1-800-243-2294.